On Monday, March 9th, the State Joint Committee on Ways and Means held its first YN 2021 budget hearing in Needham. The hearing focused on health and human services. Several senators and representatives brought up concerns on the current COVID-19 crisis, including the anxiety and fear raised among the communities due to the lack of information on testing capability and the criteria for testing.
When do you expect us to be able to have more tests? How many do we have now?
Yep.
And, what about like having testing sites, not getting everyone else sick at the emergency room, things like that?
The Department of Public Health Lab has the capacity or the ability to sort of do about 50 tests a day. We're expecting at least a commercial lab to also be approved by the federal government to do testing in Massachusetts.
So someone who has not had direct documented contact with corona or traveled to one of the 5 countries can still get a test? Because
Yes.
I'm not sure. Yes, okay.
But it depends on the situation.
Depends on, is that the determination of the doctor, or is it something DPH is?
It's a collaborative decision made between the Department of Public Health and the individual clinician. Just to be clear, part of the testing capacity issues at the State Public Health Laboratory, we are capable of running the tests. State Public Health Laboratories are the only place where they can be run now. As the Secretary mentioned, there are private independent labs that are looking to come on board, maybe as soon as this week. However, many of them, the few that I have heard from, are testing still in, for example, just in California. So it would still be a lag time in getting those back.
Sure.
All of our academic facilities are working on trying to put the test up, but are not there yet.
Your advice right now for local superintendents to sort of wait and see, absent a positive test in their community, should people kind of just be monitoring it, doing the disinfectants, or should there be conversations in school departments right now about closing?
If an individual is exposed, as you're suggesting in certain cases, then local Board of Health, with support of the Department of Public Health, interviews that person, and all of the relevant contacts related to that person are contacted and informed whether they have to do the quarantine or not. We have had a lot of questions in the community saying, well, how will I know if I'm supposed to stay home or not? The people who need to stay home are notified. And then for everyone else, it's about this hygiene and the cleaning. The school preparedness thing does talk about, thinking and being prepared. If you did have to close, how would you manage that? Would you continue education if you have teachers out? So that kind of thinking ahead is really important to do now, because it's easier to do when we're in planning as opposed to in a crisis.
Other than the imminent COVID-19 virus concerns, over vaping, opioid abuse, and vaccine rates were also raised in front of both Secretary Marylou Sudders and Commissioner Monica Bharel. The Joint Committee later heard testimonies from other state agencies, including the Office of Medicaid, Department of Public Health, Department of Children and Families, Office of Children Advocate, Department of Developmental Services, Department of Youth Services, Executive Office of Elder Affairs, and Center for Health Information and Analysis. They discussed the Mass Health Program, the State Healthcare Information System, and state support for adoption, child abuse prevention, autism, juvenile delinquencies, and veteran services. You can go to needhamchannel.org to watch the full hearing.